I'm a frustrated doctor. As a clinician working in emergency centers, I spent more time trying to find equipment, find a porter, find a booking slot for my patient, find a bed for my patient, find my patient, than I did really helping anyone get better. And all this while squeezing through the multitude of desperately ill people who were just crowded into every nook and cranny in the emergency center. Emergency center overcrowding is like a disease, in that it has known symptoms, known causes, and most chillingly, known mortality rates. Studies show us that mortality risk almost doubles when patients are kept in emergency centers for too long. We did some backwards calculating based on these studies, and we realized that about 44% of patients dying in our hospitals were dying preventable deaths. And just in case you're sitting out there thinking, wow, sucks to be a South African, this is a global issue. In 2009, I stepped out of the crazy to try and support teams from a small group of hospitals to improve their patient care processes. And then in mid-2010, I stepped right back into the crazy, going from single gal to single mom overnight when I adopted 2 teenagers. I'm not going to tell you too much about my kids' history. I think that's for them to tell in their own time. But you can imagine if they're adoptable as teenagers, that they've seen far more than their fair share of suffering and rejection. So you may well be wondering what on earth improving healthcare and raising adopted teenagers have in common. I mean, on the one hand, you have these incredibly vulnerable people, burgeoning with purpose, abandoned by the very people who are supposed to nurture and protect them, and bearing loads that are just too heavy, now finding themselves in complete survival mode. And on the other hand, you have these two. Our healthcare system is in survival mode, and we can tell that by the behavior of our people. We all know the stress response, fight, flight, freeze. Well, 1/3 of our patient complaints are about staff attitude. And it's not just the patients that we fight with. We fight with everyone. Clinicians versus managers, doctors versus nurses, speciality versus speciality. 30% of my classmates are now working overseas, and another 40% have flown to the safer climes of private healthcare, or right out of healthcare altogether. And a recent study shows us that 70% of all public healthcare workers show signs of depression or burnout, or both. So we have a healthcare system that's neither particularly healthy nor caring. And in these complex contexts with their complex histories, it can be quite difficult to know how to navigate, because you don't know what you're going to set off inadvertently. When my kids first came home, they would cringe away from a high five, or something as innocuous as covering school books could set off a complete hysterical meltdown. I would go along to parenting talks, and the speaker would be on about how this is so important, this is the most important stage in the formation of your 2 to 3-year-old's brain, and it dictates how they'll deal with X, Y, and Z in the future. And I'd be sitting there thinking about what I know about my kid's background, and just be going, well, crap. Because given the choice, I wouldn't have chosen to start here, with my kids or with improving healthcare. But this is where we were. So how do we go forward? When the early pilgrims first started settling on the Great Plains of the United States, they encountered blizzards like they had never experienced before. They couldn't even see the hand in front of their face, never mind the path back towards the house. And the anecdotes of people being found within feet of their dwelling, dead from hypothermia, having wandered around for hours trying to find their way home. What these families ended up doing was tying a rope from the barn to the house so that if the blizzard struck while they were at work, they could take hold of the rope and follow it step by step home. And I kind of feel like the situation we found ourselves in with the kids and with healthcare improvement was like that, where we couldn't see the hand in front of our face, never mind the path ahead. And so we needed to find these lifelines, these things that we could hold on to. The lifeline in healthcare improvement is respect. And when I talk respect, I'm not saying the respect must be earned kind of respect. I'm talking about the respect for the intrinsic worth or personhood of the other. So what does that look like? Well, firstly, it's about having a deep respect for the patient and their needs. We've got to do the difficult work with the patient to understand those needs, and then look to see how our system is aligned, or not, as the case may be, to meet those needs. But secondly, it's about respect for the people delivering the service. In the improvement community, we work on the premise that staff don't have a duty or an obligation to do excellent work. They have a right to do excellent work. So we've got to go and see what's making it really difficult for our people to do the work that they have a right to do. Are staff spending hours trying to find stuff? Or clarifying tasks? Are they handed policies from on high that are literally impossible to implement on the ground because of clashing processes and policies? Are staff involved in finding problems and solving them? Or are they hauled off for disciplinary because problems shouldn't happen in healthcare? How are we respecting our people? With the kids, the lifeline was love, and it really didn't take much. Any small thing, any bit of positive attention, and my kids just melted. One afternoon, they had spent the day with my sister, and one of them came home, face glowing, and as if revealing a secret treasure, said, "Auntie Wind called me her sweetheart." Auntie Wind is my identical twin sister. She's very invested in this talk, by the way, because she reckons it's her face that's going to be saying things from on stage. She's actually got 3 adopted kids of her own, and we've often spoken about how it's the small, consistent, repeated acts of love that really grow out our kids. The little steps, one foot in front of the other. And we found it was actually the same in improving our healthcare systems. We kept thinking it was going to take these wild, out-of-the-box ideas to really solve our deep issues. And when it comes down to it, it's really the small things. Move the printer from here to there, rather. Order the discharge medications the day before discharge, rather than on the day of discharge. Let's huddle for 5 minutes and talk about what we learned yesterday and how we're going to apply that learning today. The little steps that, taken one after the other, lead us towards home. So, looking in from the outside, or even in hindsight, these steps seem so simple. We wonder why more hospitals aren't taking them, or why there's so many neglected kids out there. And they are simple, but they're not simplistic. We're in a blizzard. So I'd always hoped to become an expert in sort of the same way that a caterpillar becomes a butterfly. You know, go off, cocoon myself off for a while, learn everything there is to know, and then emerge as the expert. Unfortunately, my experience has been a little closer to tadpole and frog. Very public, somewhat humiliating. At various points, I don't know if it's a new limb growing or yet another wart, and I reckon people watching on have got to ask, what is that? And part of the reason for this is that I'm a product of the same dysfunctional system that I'm trying to help improve. So I'm working with teams to help them think differently, and at the same time having to challenge my own mindsets. Like, try as I might, I still don't really get surgeons. And not only am I a product of my context, I'm a living part of it as well. So we'd be going along and the kids would do something completely innocent, but it would strike something deep in me that then I had to deal with. And this dealing with had to happen on the run, while sleep deprived, while trying to get to know these strangers who had taken over my home. So you have to ask yourself, what does respect look like right now, when I'm annoyed as hell with the manager that I'm trying to support? Or when the respect isn't reciprocal? What does love look like right now when I'm absolutely exhausted and the child has mutated? Sometimes love looks like putting my arms around my child and saying, "I love you, my babe." Sometimes it looks like just not strangling them. And sometimes what I do doesn't look like love or respect at all because I just lose it and I couldn't care less what it looks like. Stuffing up is inevitable, and it's frequent, and you don't get to rewind. all you can do is stand in this new context that you've just created, take hold of your lifeline, and put one foot in front of the other. So you know where we started. Where are we now? 3 of the 4 hospitals that I first started working with have seen drops in mortality rates of 30%. Thanks. If we want to put some numbers to that stat, that's about 150 patients a month who were dying in these hospitals, these 3 hospitals. We've taken that down to 105, and counting. You can see the orange little manies there. That's our goal. And if we want to put some faces to these numbers, that's this audience. It's just over 1,000 people now today that, instead of dying, have been able to go home to their families, to hug their grandchildren, to share another meal. And it's not just the patients. The staff have changed as well. They're engaged and they're excited about their work, and they actually like each other now. They'll admit now that they didn't like each other much before. And on the home front, I'm happy to announce that we've managed to maintain a mortality rate of 0% over 5 years. And where I once had very timid, obsequious, compliant children, my children are now loud, opinionated, larger than life, high-fiving and dreaming of how they can change the world. So what does this mean for us? I think we find ourselves in a difficult context, in our country and in the world. Given the choice, we wouldn't have chosen to start here. But this is where we are. So how do we go forward? I want to suggest that we don't wait for the large, out-of-the-box interventions to save us. Rather, let each of us, with our own rich and painfully raw histories, in this context of which we are both part and product, take hold of the lifeline of respect for the intrinsic worth of the other, otherwise known as love. At each step asking, what does love look like right now? And then humbly putting one foot in front of the other. This way, together, we will find our way home. Thank you.